This lecture is about hepatitis B virus and hepatitis D viruses. The objective of lecture are introduction, structure of hepatitis B viruses, mode of transmission, then replication and life cycle of hepatitis B virus, epidemiology of hepatitis B, clinical outcomes, laboratory diagnosis and prevention and control of hepatitis B virus. Hepatitis B virus, it damages the liver, it causes icteric symptoms, and it also causes change in the liver enzymes in the blood. Classic hepatitis is caused by hepatitis A and hepatitis B virus. Other non-A, non-B hepatitis virus are C, D, E and G. Hepatitis B virus, also known as serum hepatitis, it is hepadnavirus. It is partially double-stranded DNA virus, belongs to orthohepadnavirus. It damages mainly liver, kidney and pancreas. It is transmitted by blood transfusion, sexual route and perinatally. It causes primary hepatocellular carcinoma, so it is carcinogenic virus. Almost 1/3 of the world's population are infected by hepatitis B virus. Vaccine available for hepatitis B is recombinant subunit vaccine. It is highly infectious. As low as 0.01 microliter of blood is sufficient to cause infection. The risk is high after needle stick injury. In comparison to HIV, there is a chances of 0.4% HIV transmission. In comparison to hepatitis B virus, the chances is as high as 27 to 37%. History part. Bloomberg in 1965 has discovered Australia antigen from an Australian patient in 1968, and it is named as Australia antigen for serum hepatitis. Australia antigen is now called as hepatitis surface antigen, HBsAg. A DAN particle is discovered in 1970 by DAN. This is a core antigen. This is a hepatitis E antigen. These all are surface antigen, and this is the phosphobilipid layer of the envelope that comes from the host hepatocyte. So this is the complete structure of the DAN particle, complete virion. This is the electron microscopic photograph of a DAN particle. This is the DAN particle, and these all are tubular viral particle. Yeah, this is elongated viral particle, this is spherical viral particle, this is complete virion DAN particle. Surface antigen. The group reactive antigen A, it is of 3 different types. One is group reactive antigen A. Other type that specify the different type of hepatitis surface antigen are, it contains either D or Y antigen or W or R variant. Different combination of these 3 antigen causes 4 type of HBsAg surface antigen. First variant is ADW, that is prevalent worldwide. Second variant is ADR, that is prevalent in Asia. Third variant is AYW, that is prevalent in Asia and Africa and Russia. Fourth type is AYR, that is also prevalent in Asia, Africa and Russia. Hepatitis B is transmitted by blood-borne sexual contact or perinatally at the time of delivery. It is transmitted by blood and blood products during blood transfusion, especially in hemophilic patients. It is also transmitted by saliva, semen, vaginal secretion, tears, breast milk, menstrual secretion, IV drug user by sharing needles, unprotected sex, birth from a carrier mother. They can transmit infection to the newborn, neonates, and healthcare personnel are also at high risk of hepatitis B virus infection. The virus concentration is highest in blood, serum, and wound exudate. The moderate concentration of virus is present in semen, vaginal fluid, and saliva, and very low or not detectable amount of surface antigen is present in urine, feces, sweat, tear, breast milk. The replication, or we can say life cycle of hepatitis B virus, this figure represents the life cycle of hepatitis B. After infection, the virus goes to the hepatocyte in the liver. First, after attachment, the envelope is removed and nucleocapsid is entered into the cytoplasm. In cytoplasm, the outer covering of the genome is removed and genome enters the nucleus for transcription, where DNA repair enzyme repairs the partially double-stranded DNA and it forms the complete double-stranded DNA. Then transcription occurs from DNA to RNA, and this RNA goes to the cytoplasm, where translation occurs for the viral particles and various antigens and seromarker of the virus. After entering into the cytoplasm, the DNA and the core assembly, both the process of development occurs simultaneously, while DNA genome is synthesizing. The nucleocapsid encircles the whole genome before it completely formed into a double-stranded DNA. So the viral genome of a hepatitis B virus remains partially synthesized, so it is partially double-stranded DNA. After this synthesis, it can go again into a nucleus for recycling, or it can go to the endoplasmic reticulum, where budding occurs and it gains the viral and it gains the capsule from the endoplasmic reticulum, where after that getting capsule, that is transported to the cell surface membrane and it goes to the circulation. So this is the complete life cycle of the hepatitis B virus in the hepatocyte. Epidemiology. This red area in Africa, Russia, and some part of America and Canada shows the very high prevalence of more than 8% for surface antigen. This yellow area, including India, part of Russia, and some part of Africa, shows intermediate level of prevalence of hepatitis surface antigen, about 2 to 7%, and this greenish color shows low prevalence in Australia, America, and Canada. And this black spot indicates very high chances of primary hepatocellular carcinoma in some part of Africa, China, like that. Carrier are the person in whom surface antigen persists beyond the 6 month. There are different type of carrier. One is simple carrier. Simple carrier do not have E antigen, DNA polymerase or HBV DNA, but they have low level of surface antigen in their blood. The transmission of infection by simple carrier is very low. They transmit infection with a large volume of blood that also contains anti-HBC antibody. Other is supercarrier. They have very high level of E antigen in their blood and they shows very high infectivity. Even a 0.01 microliter of blood can transmit infection. And it has very high level of surface antigen, DNA polymerase and HBV DNA in their blood. This figure shows the clinical syndrome or clinical features of hepatitis virus. Incubation period is 1 to 6 months. It causes fever. It causes jaundice. There is yellowish discoloration of bulbar conjunctiva. There is pain and tenderness in the right hypochondric region of the abdomen. Urine turns to dark yellow or brown. Feces color change to yellow pale. This shows the pale yellow. There is yellow discoloration of the bulbar conjunctiva. Now, chronic outcome or clinical outcome of hepatitis B infection, almost 90% of the patient resolves by themselves and doesn't go to chronic state. About 1% of the infective patients develop fulminant hepatitis and about 9% becomes carrier that are surface antigen positive for more than 6 months. Among this 9%, 50% resolves themselves. Rest of others develop asymptomatic carrier state, chronic persistent hepatitis or chronic active hepatitis. Chronic active hepatitis can develop into hepatocellular carcinoma or cirrhosis, or they can manifest as extra hepatic diseases like polyarthritis nodosa or glomerulonephritis. Laboratory diagnosis of hepatitis B virus infection. It is based on clinical and biochemical data. Clinical feature of hepatitis B, as we already seen in previous slides, and there is elevation of serum bilirubin and liver enzymes like SGPT and SGOT. Surface antigen detection by standard test, by rapid chromatographic test or ELISA. Then detection of viral particle, that is HBV DNA by PCR and other serological marker of hepatitis B virus. And these are the serological marker. First is surface antigen. It is the general marker of infection and it is the first antigen to appear in the serum after infection. Then antibody against surface antigen, it indicates recovery and or immunity or vaccination status, vaccinated individual. Antibody IgM against C antigen, it indicates acute infection and it is the first antibody to appear after infection. Other is IgG anti-HBC antibody. It indicates past or chronic infection. Other antigen is E antigen. It indicates active replication of virus and high infectivity of the patient. Antibody against E antigen, it indicates no replication and recovery. Then HBV DNA, it indicates active replication of virus in the body and it is more accurate than this E antigen detection. Yeah, in x axis it shows the time interval from infection to the chronic state, and in y axis it shows the level of serological marker, and this line shows detectable level of virus marker. First antigen to appear in the blood is hepatitis S surface antigen. Once anti-hepatitis S antibody appear in the blood, the surface antigen level goes down in the blood. The period between appearance of antibody against surface antigen and disappearance of the surface antigen in the blood, this period is known as window period in case of hepatitis B virus infection. This hepatitis E antigen disappears in about 4 to 5 weeks once antibody against E antigen appear in the blood. This is the first antibody to appear in the blood after hepatitis B infection, and that is hepatitis B C antibodies. Once it is produced, they persist for a longer period of time after infection. This graph shows all serological marker together in one. First antigen to appear is hepatitis S surface antigen, and first antibody to appear is hepatitis B C antibody. Prevention and control. Hepatitis B infection can be prevented by universal precautions. Healthcare worker and laboratory workers should always wear healthcare worker and laboratory worker must wear gloves and other personal protective equipments for prevention. Use of disposable syringes and sterile needle is must, and mouth pipetting is not allowed, and mouth pipetting must be avoided. Screening of all the blood and blood product for the presence of surface antigen is done to prevent transmission of hepatitis B infection in the recipient. Passive immunization can be given by antibody against surface antigen, monoclonal antibody against surface antigen, and it is effective if it is given within 48 hours of exposure to hepatitis B virus. Neonate born to the mother with HBsAg positive and HBeAg positive. It is given after needle stick injury. It can be given after suspected personal contact. Active immunization. It is recommended for infant and children, and also healthcare persons and drug abusers and patient requiring frequent blood and blood product transmission. Active immunization is done by subunit vaccine produced by cloning surface antigen in a yeast cell, that is recombinant vaccine. In adult and children, 3 doses of recombinant vaccine is given. First dose is given at day 0. Second dose is given after 1 month of first dose, and third dose is given after 6 months of first dose by IM route. If mother is surface antigen positive, the first dose of vaccine along with immunoglobulin is given to neonate. Second virus is Delta virus, that is incomplete virus. It is This virus is identified in 1977 in a carrier patient of hepatitis surface antigen positive. It is defective RNA dependent virus. It requires helper function of hepatitis B virus for its replication and expression. It is defective virus. This is the RNA genome. Here it is the delta antigen, and here it is the surface antigen that is acquired from the hepatitis B virus. This delta virus doesn't have genetic code for synthesis of the surface antigen. This is electron micrographic picture of the delta virus. There are two modalities of transmission of hepatitis D virus infection. Either hepatitis B and D virus can infect simultaneously, and that is known as co-infection, or hepatitis D virus can infect into a hepatitis B carrier patient, carrier subject, and this is known as super infection. This is more common in IV drug user, while co-infection is more seen in blood product or drug abuser. The consequence: in co-infection, cirrhosis is more common, and in super infection, patient goes into a chronic delta infection state. Laboratory diagnosis of delta virus can be done by serology. In acute infection, anti-HDV IgM that appears in 10 to 15 days after the onset of disease, and in chronic cases, anti-HDV IgG that appear in the blood after 2 to 11 weeks of infection. In this lecture, we have covered structure of hepatitis B virus, mode of transmissions, clinical disease, laboratory diagnosis, and this is the complete diagram showing all the consequences of hepatitis B along with seromarkers, along with liver enzyme and symptoms. Broadly, it is divided into three phases. First is incubation, where HBsAg antigen appear in the blood. This is HBsAg antigen level in blood or serum. In this phase, there is DNA polymerase activity taking place, and virus particles are actively replicating in the body. Second phase is acute disease, where surface antigen and antibody against C antigen is present in the blood, and there is elevation of the liver enzyme, and patient is symptomatic. Third phase is convalescent phase, that is early and late. In early phase, there is presence of antibody against C antigen, and that is core window. This period is known as core window period. Only antibody against C antigen is present, along with low level of anti-HBe antibody. And last phase is late convalescent phase, that have anti-HBs AG antibody and anti-HBc antibody. Thank you very much for watching.